Hello, everyone. Thank you for joining Christine and I today. This is we figured it was very fitting in the month of May with Mother's Day and end of the school year and all the things that us as mamas and women are go, 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 busy, busy. And so we decided that this topic would be very fitting. We called it Women's Vitality Masterclass. And we wanted it to be more conversational, more informal in the sense of like not me presenting slide after slide of information, but just really hitting and honing in on conversation, awareness, empowerment, and action. And hopefully that'll help generate some additional questions that you might have. And or our ultimate goal is that you're going to walk away with a few new pieces of very important health information that you did not know before this masterclass today. So with that, I'm going to let Christine introduce herself, and then I'll introduce myself, and then we'll jump into the content.
Sounds wonderful. I know I got distracted. I have someone trying to jump in.
Do you want me to?
So
I can introduce first.
yes, doing a
Okay.
yeah, I'm trying to
Okay.
send the link. I love
Okay.
this.
All right. So, for those of you that don't know me, I'm Julie Brown. I am a functional medicine nurse practitioner. I am board certified and licensed in both Colorado and Florida. So, I have about 50% of my patients are in Colorado and about 50% are here. My passion of opening my own functional medicine private practice, I am officially 2 years live in my private practice, but have over 28 years of healthcare experience primarily in the conventional space. So I love that I'm able to help my patients walk through that journey, both functional and conventional, because I've been on both sides, both not only obviously as the provider, but also as a patient. And I was told by multiple specialists about 7 years ago that my symptoms were probably just high stress, and all my labs were coming back normal, everything was coming back normal. So I ended up doing my own additional deep dive functional medicine testing as a nurse practitioner, able to order for myself, and I came to the root cause and have been symptom free ever since. So I am very passionate about I see you, I hear you, I believe you, having been on the patient side, knowing what I know and able to advocate for myself. I want to empower women that just don't even know where to start, what questions to even ask, and how to help you do that in a very respectful way with your current conventional team. And now you have Christine and I as additional resources to help guide you along the way as well. So, with that, I'll let Christine introduce herself.
Awesome. Yes, Christine Van Diest. I'm here in Colorado. I love helping women, high capacity women. I feel like I help out. It seems to be because we just carry all the plates. We have all the roles, responsibilities. We seem to take care of everyone else. And then we just get to exhaustion, burnout, fatigue, and we forget to dream. We forget to advocate for ourselves, and we just need to remind ourselves. So I love that strong body, restored soul. I'm a personal trainer and restorative coach. So really helping women on the inside and out transform their lives. And I love partnering with Julie. I feel like, I mean, I wish we were in the same state together,
Oh,
but I love that we get to do so many of these webinars because I think we just really want to advocate for you and just help you advocate for yourself and just give you a lot of tools and resources and tips. So we're here today to start in these great conversations about women, what we can do to really thrive and not just merely survive. So that's really so much of what we love to do.
I say that all the time. I think we're just literally surviving. We're just in survival mode. And so hopefully we'll give you some good tools and information today so that you know what to watch for, what to ask about, and most importantly, what not to dismiss. I think as women, we are so busy multitasking, juggling all the things that we tend to dismiss a lot and kind of just keep trucking along. And I hope after today there'll be some key things that you're always going to have in the back of your mind, and you'll hear Christine and I from this talk today be like, oh yeah, they did talk about that. So we're going to cover four key areas. We're going to cover heart health, brain health, bone health, and arguably probably my most favorite topic, bladder and vaginal health. And then if we have time at the end, we do know like this is in the middle of the day, so we're going to try to be mindful of time, give you lots of great information and concise as possible, and maybe have some myth busters at the end and or a Q&A based on the questions that you have for those of you that are on the call. So,
Awesome. Well, I'm going to kick it off because I
okay.
love having Julie here. So, Julie, I'm going to start with you. So, we are going to volley back and forth, you guys, on our questions for one another, and super excited. But okay, for Julie, nurse practitioner, functional medicine, cardiovascular disease is the leading cause of death for women. yet it's often missed. Why are standard cholesterol panels sometimes misleading for women in perimenopause?
Love this question. Okay. Cardiovascular disease actually kills 1 in 3 women, and probably only a little over half of us even realize as women that this is the number one killer for us, more than all cancers combined. Cardiovascular disease, more than all cancers combined. I'm saying that again because that's like, people are like, wait, what? Women are 50% more likely than men to receive a wrong initial diagnosis because we don't present the same. We don't present with the classic elephant sitting on your chest, left jaw pain radiating down your left arm. That's how men present. Women usually will present with digestion issues or like reflux issues or fatigue or just kind of like a little winded. They just feel tired. So it's more atypical. It's not to say that we don't also have chest pain, but because it's more vague and not textbook classic, we more than 50% of us would present to the ER, possibly if we even went to the ER, because we're too busy doing everything to even go to the ER for those type of symptoms. With an initial wrong diagnosis when it really is a heart attack. Regarding the standard cholesterol testing, this is a good one for me, so thank you for asking that specific question, because your standard lipid panel, which is your total cholesterol, triglycerides, LDL, and HDL, those are like the key four that are standard and done. Those are kind of giving us a general idea of your overall numbers, but it doesn't give us actual individual damaging particle size. And for all of my patients, I do look at the standard lipid panel, but I also do the LP little a, the lipoprotein little a, and the apolipoprotein B, or the ApoB. So those are measuring actual individual particle sizes. One of them can be affected by lifestyle changes, and so you can move the needle in the right direction, but you just have to be aware and have it checked. And then the LP little a is genetic. So it's really, really important because those people have a higher risk of clotting, higher risk of calcification on their aortic valve, and strokes. So those two are checked. So I think of it as like little BBs going around in your arteries, and the people with a high LP little a have like spikes all over their BBs. You can't get rid of those, but we can do things naturally to help kind of blunt or soften those edges to reduce the damage that's happening inside your arteries, which is causing the inflammation, which is causing the plaque buildup. Just think, it's like scratching those arterial walls, and those need to be repaired. Well, repair comes in the form of plaque buildup, and plaque buildup over time narrows our arteries, which is what causes the heart attack and or stroke if that plaque breaks off. Another thing that's really interesting is that over 50% of heart attack patients have completely normal cholesterol levels. So over half of heart attack patients have completely normal cholesterol levels. So it's more important to know that individual particle number, that LPA, to know if you genetically are predisposed to having more issues. So don't just go off of a normal cholesterol.
Okay, that was my question because I think for
Mm-hmm.
many of us that are not in the medical field and would not know that, like regular labs, so that's something that I think, when you guys get the recording of this, it's just even knowing if I have labs done, what am I really looking at? And what do I need to ask specifically to my provider or whoever is going over the labs with me? And this is always a plug I have for Julie. If you're in Florida or Colorado and you've not had your labs done, you can use Julie. And like you can see, she just explains everything so well, and she'll just keep explaining it until you understand it. So, anyway, you need to get someone that understands what you're supposed to be looking at, and not just the generic answer that your labs look okay, they look good, and you don't know what's underneath, right?
Yeah. For
Okay.
our perimenopause and menopausal women, especially those hormone changes, and especially like the decline in estrogen gets a really bad name, but it does so many wonderful, beautiful, protective things for us. And so that transition does increase our heart attack risk. And
Mhm.
one of the first signs is that on your standard panel, you for 20 years have had blood work done off and on, and all of a sudden the primary care team looks across the table at you and says, oh, your cholesterol level's climbing, we need to put you on a statin. First and foremost, we need to know where your LP little a is and your ApoB is. Those are two additional very independent sensitive predictors of heart disease in women. So you need to know what those are. I This is one of the key things I hope you take away. The reason why your cholesterol is climbing is because your hormones are changing, and your body's natural God-given response is to raise cholesterol to try and recruit and build more hormones. So it's one of the first key signs that your hormones are changing, and those need to be balanced and addressed. So that's the root cause. A statin, if your cholesterol is driven below 150, a statin increases your depression and suicide rate by sevenfold. So
Mm,
700% if your
not good.
cholesterol is driven below 150. And as perimenopausal and menopausal women, we're already struggling with new or worsening anxiety, depression, fatigue, brain fog, all of those things. So a statin on top of that could be very, very damaging. So
Yeah.
I could go on this topic a
I
long time.
know
I'm going to
that's really
pause.
good. So we'll kind of have our
So, yeah.
yeah, we'll definitely have our good follow-up on that. I think that's excellent. Things that we didn't know. Typically we would not know that. So
Yeah,
thank
so
you.
the statin is a buzzword, CoQ10 is a buzzword, your standard lipid panel, those types of things. Women presenting not typically, not classical, with the elephant on your chest, left arm pain. So those are like, that's my medical lens. So this is the beauty of Christine and I. We are an amazing duo. And so Christine, I'm going to toss one at you.
Okay.
How can lifestyle and stress management act as preventative medicine for women's vascular system before a problem arises?
hmm And I love this because I think for me, it is about prevention. But when I was thinking of the vascular system, it was for me understanding of what does all that encompass? And that is like our blood system, and just the highway and byways, just really that everything is clear and free so that the oxygen, the nutrients, the blood is circulating in our body to everything in our body, our organs. If not, that's where a lot of the problems arise. So again, it's stress. Like when I think about lifestyle, I think sometimes many women can say, I'm so overwhelmed, I'm so stressed, I'm so this, I'm so burnt out. So literally from our mindset and our thoughts and our habits and what we say,
Yep.
already our body's like, oh, she's stressed out, she's burned out, she's fatigued, exhausted. So literally the sympathetic system is going to take over in our nervous system, and it's going to take over and prioritize, let's address that stress. And then it shuts down what our parasympathetic wants to do of rest, digest, restore, heal, recover. And so if we're in that chronic stress, that really does amplify whatever is going on in our body and system because we're not getting to heal it and we're not getting to recover and restore. So I think that's really important too, as far as with our really reducing stress and actually having some good habits in our habits and our when I think about, stress management is so important. And another thing, as far as when I think of overall health, is strength training. So I
Mm.
think stress, we got to really nip it in the bud and really do things to help us reduce the stress. And that's something that we can individually talk to people about. And then muscle is just the currency. It's really like our metabolic currency, and we need to have strength training. And so I think that's just where it impacts our blood sugar and impacts how we really what we eat. It gets into our muscles, it just gets balanced out in our body and helps us if we're doing strength training. It helps reduce that fat accumulation, which can also be that visceral fat that's not good for our bodies, and just improves so much of our mindset and our mood. And it's part of that, our body recovering. So,
Yeah.
it's really hard. I think it's we just we all have the same 24 hours in a day. So it's actually we have to tell ourselves, and maybe it's accountability, maybe it's paying for a coach or paying for someone. We're really helping to, say no to things, have these boundaries, and put in some of these really good lifestyle habits of I need sleep, I need a walk. That will really help after a heavy meal. Protein intake, hydration, and reducing the stress. So I think it's not just, yeah, when I have time. No, this is at the age where we need to say these are non-negotiables. These need to become some daily habits if we really want to be thriving as we age in that longevity piece.
Yeah.
We really need to take it seriously.
Yeah. Anytime you mention the word stress, to me, like in my medical brain, I think stress equals inflammation. So if there's
Mhm.
stress, there's definitely inflammation. And that is not cardioprotective, heart protective, immune system protective. So we want to minimize. There's going to be stress, but we want to minimize it.
Yeah.
When we get into our bone health category, I'm sure Christine's going to give us some amazing tools and things that we need to do regarding strength training and the importance of that to reduce our bone fracture risk as we
Mhm.
age.
Yeah.
But my next most favorite topic, not the bladder vaginal health quite yet, but the topic of brain health and Alzheimer's.
Oh, yeah. So I think, Julie, this is where your expertise in this, but with two-thirds of Alzheimer's patients being women, which I didn't know that
Crazy.
statistic,
I
we
know.
have to talk about estrogen. And this is where, again, as we age and, perimenopause, menopause, our hormones are changing. What is the link between the estrogen dip and the brain fog or cognitive decline that women fear the most?
Yeah, so I, even myself personally, until I was in the functional space, didn't appreciate that two-thirds of Alzheimer's patients are women. I was just like, and so that in the functional space gets me to the, well, why is that? I mean, we're all aging men and women. We have the same brain. Like, why? And it's a huge link to the decline in estrogen. So that's how brain protective it is. Estrogen helps with our neurotransmitters. So think of your feel-good hormones like your dopamine, your serotonin, your norepinephrine. It helps vasodilate, so it's providing the oxygen and glucose that your brain thrives on. Um, so women who use estrogen therapy and that perimenopausal, more so menopausal window of time, have up to a 30% reduction in Alzheimer's rates. Just that's how protective estrogen is. Only 5 to 10% of Alzheimer's patients are like purely from a genetic reason. Only 5 to 10% is genetic. Another thing that if you've watched any of my webinars or you're one of my patients, you know that Alzheimer's is called type 3 diabetes essentially. So it's a big sugar issue as well. But for women, the fact that two-thirds of us, of those who are, are Alzheimer's patients are women is just insane to me. So it's really important. Alzheimer's doesn't just happen at 72 or 70 or 75. It's
Mhm.
happening because of 10 to 20 years of typically lifestyle choices that has increased your risk or incidence of you developing Alzheimer's. So that brain fog that you're experiencing during perimenopause isn't just like all in your head or you're just too stressed out or too busy. There's definitely like a neurotransmitter. Think of estrogen as like your brain fuel. And when the estrogen levels drop, your brain is getting less fuel, which is why your word finding, you're forgetful, where you're like, where did I put the key, or where was this? And your family's like, we just talked about that. You're like, okay, I'm sure we did. And then sometimes it comes back to you when they like give you a few keywords, and you're just like, you start Googling, do I have early onset dementia? Like that brain fog is estrogen's your brain fuel. It's our brain fuel, and it does decline. It's inevitable. It's going to decline with aging. So we just have to be proactive, and just being mindful of keeping those levels balanced in the most natural way possible based on medical conditions and other things like that. But it just is insane to me. Like the fact that two-thirds are women is just
Mhm.
crazy to me.
Yeah. Can I
Depression. Oh
Can I
yeah,
ask a
sorry.
follow-up on the
Yeah.
estrogen? So I think because sometimes too, people are like, when I look at my labs, like what's healthy number for estrogen? Because there's different ways, and maybe you'll talk about this later, but because I think too, if people are like, this is dire, I need to make sure my estrogen levels are not just subpar, but really are optimal, not just, you know, kind of like I'm hitting the bare minimum so that I really am in the right spot I need to be.
Yeah, so I look at all of your hormones, so your estrogen, progesterone, testosterone, your DHEA, sex hormone binding globulin, and a few other things. For the sake of time, I'll just say like I'm looking at all the things and how they are interrelated. So estrogen is as far as what's optimal, it depends on what cycle and phase and stage of life you're in. So are you in your 20s? Are you dealing with PMS, PCOS? Now it's PCMS instead of PCOS. It just recently got the polycystic ovarian condition just got renamed this past week. But so it's like basically like multi-endocrine. So it's indicating that there's more than just the ovaries involved, which I'm like, thank you. Makes so much more sense. Sorry, I digress. But the estrogen is different. Optimal estrogen is different based on what stage and phase you're in. And
Okay.
so I'm not trying to get your estrogen levels to the levels they were in your 30s when you're in your 50s and 60s and we're transitioning in perimenopause and menopause. It's what's optimal for you. How is your mood? How's your motivation? How's like the brain fog? Do you still have a uterus? Do you not have a uterus? Because those are all things that I need to know uh, based on, is it appropriate? Do you have a breast cancer diagnosis? Are you actively going through breast cancer? So there's so many different variables. So I guess the short answer is optimal is specific to the patient, which is the beauty of functional medicine is I'm not looking for green light, red light. I'm actually like based on your symptoms, how you're presenting, where do you need to be. I just had a patient text me about an hour before the call, and this was about progesterone, not estrogen, but it's a similar thing. And she's tearful, happy tears, because she said, Julie, for decades, I have been seeing doctor after doctor, specialist after specialist. And even you said my level was normal, but likely not optimal based on my symptoms. For the first time in 20 years, me listening to her and helping the number be optimal and not just normal and dismissing her, she feels like a whole new person. She feels
Mhm.
incredible. So your labs may look normal, but that does not mean they're optimal for you, and that's different for everyone. So, and I don't want to forget to talk about the three types of estrogen, but I want to give you a chance to kind of give us like, your perspective on this topic as well. So, because Christine is really good about keeping us all accountable and giving us all the tools in the toolbox for ways that we can be metabolically flexible through lifestyle, nutrition, and moving our bodies. So, what are three daily metabolic habits that can help protect our brain health starting today? They walk away from the webinar with three daily metabolic habits for brain health.
Awesome. I'll make this short and sweet. I would say prioritizing protein. And honestly, my husband just started doing this 2 months ago, and ChatGPT or Claude, whatever, which one he is in now, has become his nutritionist in a loose mind way where it's accountable. He will speak into, just even speaking into what he's eating and saying, this is how much I weigh, this is what I want to lose, but what's the grams of protein that would be healthy for me? I'm a man, 245. And so he's lost like 17 pounds. And the biggest thing is he started prioritizing protein, eating more protein. And he was like, what are some examples of protein? So, number one is prioritizing protein. And if you feel stuck using some free services like that, what are some good protein samples for breakfast, for lunch, for snack? What is a good target? What are some good ideas? So, just knowing that you have something, we all have a phone usually, and so something at our fingertips that will help us stay accountable and give us ideas. Um, One thing I did that was really cool, Steve and I split a month's supply of Estella.com. I got 2 weeks worth of hard data on how my body fluctuated, my blood sugar fluctuated with food. It was a great aha. I only did it for 2 weeks. That was really helpful to understand how certain foods affected my blood sugar to remind me, don't eat this food alone. Put a fat with it, put a protein with it, put some fiber, and really helped me. Knowledge is power. It really helped me understand. Number two would be move your body daily, and it would just be making it a non-negotiable. Even if you feel like I only have 10 minutes, 10 minutes is golden, and using it after your major meal, like after dinner, before you sit down, before you even start cleaning the dishes, put things away, go outside, go walk around if it's good weather. Just really make that such a beautiful rhythm of your day to walk, to move, to sign up for something, have a goal movement wise. And the third one, again, is protecting your nervous system, really knowing that if sleep is a struggle, spend this next week thinking how I can get better sleep. What do I need to do to slow down, to eat, make sure I'm not eating so close to dinner? What is it like as far as like blue light to get off my phone an hour before? If stress is what are doing about like I do things like breath prayers or just if I'm overwhelmed, I literally sit in my office, I listen to a couple of my favorite songs and I just close my eyes and I breathe deeply. So whatever it is, journal, meditate, prayer, really get your body back into that parasympathetic. That will go far beyond because if your body is in that fight or flight
Yeah.
constantly, you're not going to get the benefits of the recovery, the rest, the digest, restoration that your body needs if we're constantly in that survival mode.
Yeah. No, that was amazing. Okay. So what was it? It was protein.
Yes, protein, move the body daily and
Movement.
regulate, really get into that parasympathetic, regulate your nervous system.
Awesome.
Yes. Yes. Awesome. Okay, so should we talk about bone health?
Yes.
Okay, so bone health. I'll start with you. So the statistics on mortality after a hip fracture are staggering.
Hmm.
Beyond just calcium, what are the functional markers we should be tracking for bone health as
So
women?
definitely starting at age 65, if not sooner, depending on like family history or like if you had an early hysterectomy, like total hysterectomy where ovaries and uterus were removed. So it kind of puts you in that surgical induced menopause. So that's going to throw you into menopause, which means the hormone producers are gone. So that puts you at higher risk for osteoporosis. So your bones get kind of spongier and weaker. So a DEXA scan, so the bone density scan is really important to make sure you're doing that routinely, especially starting at age 65, sooner if you have some of those other things I just mentioned. What's really concerning is that estrogen is extremely bone protective as well as testosterone. So most of us don't get, like, men talk about testosterone and men go on testosterone replacement therapy, but for women, it's not really talked about as much, but it's equally as important for us. So 1 in 2 women over the age of 50 will break a bone due to osteoporosis. Half of us. Like, that's insane over the age of 50.
Mhm.
Hip fractures double your risk of death within 1 year. So I know all of us can think of a story or know somebody whose grandma fell, fractured their hip, went into the hospital, had it replaced and repaired, and then within a year, half of those women will die.
Mhm.
Even more so if they are cane and are walker dependent. Their mortality rate goes up significantly. Um, 50% of women who break a hip never regain full independence. And so then you've got the depression that comes with that, and it's just this spiral. So bone health is really, really important. So the DEXA scan, your vitamin D levels are really important, magnesium, calcium. So just making sure that, and hormones, and making sure your hormones are balanced. Earlier this morning, I was just going through my hormone reels that I go through. I got my favorite people that I follow, and uh, Dr. Casperson, she was talking about testosterone therapy will reduce the need for cane and walker use by 50% within 6 months after a frailty fracture or a fracture due to
Mhm.
osteoporosis. So 50% of those people that would have been in that category of mortality, half of them won't die
That's
with the
great.
support of testosterone therapy. And it's just, it's incredible to me. So
Mhm.
with the decline in estrogen, our bone loss accelerates exponentially in the years immediately before and menopause. So I have a lot of people say, Julie, like, well, I it was a menopause 2 years ago, so really, like, and I don't have hot flashes anymore. So do I really need hormone replacement therapy? I mean, have I missed the window? When is it too late? That's another thing. Well, is it too late? And really, in that first 10 years is where you're getting the most benefit for
Mhm.
that hormone balancing and support. I have some women that stay on it beyond 10 years just because they feel so amazing and great and they're active and thriving and not just surviving. But really, it's that first 10-year window that you get the most bang for your buck or the most health benefits for cognition, heart health, bone health, and what we're soon to talk about here in a little bit, bladder and vaginal health.
Awesome.
So, for you, Miss Christine, many women fear osteoporosis but don't know how to train against it. So this is kind of what I was alluding to before
Mhm.
is like you're our movement guru. So what type of movement is non-negotiable for bone density as we know those estrogen levels are plummeting?
Sure. I mean, this hands down, it's the strength training. Like walking is wonderful. Walking is restorative. Walking is good for that blood sugar uptake after meals, but our bodies need resistance and they need that to carry that load. And that is how we are going to protect against the osteoporosis and the bone breaking and the fractures. And truly, that strength training is something that helps like posture stability. It helps I would say even too, just joints And it really has become the longevity. Muscle is the currency of longevity that truly, like you said, if we are falling and we have fractures and we're not taking care, then we just spiral. We really go down from there. So even thinking things that like learning how to do farmer's carry, that's where you are building up strength. Your arms are straight by your side, but you're starting to carry a load because even as you age, I want to bring in potted plants. I'm going to bring in groceries from the car. I need to have that strength and that grip strength. And that's what they're finding as we get older. If someone is to fall and they do not have that grip strength, that they can't grab onto something, to a chair, to a stairwell, whatever it might be, grip strength is amazing. So anything with your big muscle movers, your legs, so it's squats, it's lunges, it's step ups, because we are going to be stepping up. That's where people start. What was that, Betty White, that still had stairs as she in her 90s,
Yeah.
which is amazing. But a lot of people go from, two-story down to a single story for that reason of I don't want to go upstairs anymore. And really, we do want to keep doing stairs. So that's so healthy. Many people will say, I've got injuries, my knees, and all those things. So for me, it's helping people build that strength in really solid ways that's not compromising maybe where there's been weaknesses. But again, progressive overload. I'm starting with the weight, and then as I'm consistent, I'm adding more weight and it's getting heavier. And so I'm really building that strength in a safe, progressive way. Because hands down, muscle becomes that protective
Hmm.
medicine as we age.
Yeah. You do
And
all
so
the
if you don't,
vitamin. Yeah. Go ahead.
yep, if you don't have someone, that's where you need to reach out to me.
Yeah.
So we need to
Exactly.
find and definitely check that as something as a daily habit. Or, 4 to 5 times a week, I say is wonderful that you can do minimum 3 times.
Hmm.
Um, minimum 2 times, but truly, I tell people if you can get 3 times in a week and be consistent, that's beautiful. It's wonderful.
I don't know if this is something you and I have talked about, but like the get not the get up and go, but basically being able to get down on the ground unassisted and get back up
Yes.
unassisted
Yes.
is the
Yes.
ultimate goal. And some people are like, I'm gonna fall, there's no way. But obviously you work up to that being the goal.
Sure.
So can you share more
Well,
about how you
well,
would
I will
recommend?
say that you're right. Like I right now train an 80-year-old. He's 3 days older than my dad. And I trained my dad a couple of years ago for that very reason that I said, I went to my dad's house and said, Dad, I want to see you get up and down off the floor.
Hmm.
And I sat there and watched him and I was like, oh, okay, I need to help him. And he was losing, he could not sit down on the ground without like falling back and not having the core strength. So I said, okay, that right there, you need to be able to get up and off the ground. So we met together probably for like 6 weeks, like honestly, once a week for 6 weeks. And after the third time, he was doing it. He was able to get up and off the ground even faster than his wife, that's almost 10 years younger. It was single leg stability. So there's certain things as far as posture stability. Um, I'd have him close his eyes, hold his hand on one chair, hand on a chair and lift one leg, close his eyes, and even just that balance with his eyes closed, like
Yeah.
being able to be aware of his body. Um, yeah, those things are very important because if you are by yourself alone, how are you getting up and off the ground? So, yeah,
Yeah.
and unassisted, I think Stacy's asking what
Yeah.
this is, what is unassisted? That meaning I can push down on my knee and get up, but I don't need a chair or I don't need someone's hands. I literally can get up and off the ground without anyone helping me. That is a great goal. That is great where we always want to be when we say that we want to be in our grandparents or great grandparents, still being on the ground playing with your grandkids or great grandkids, that you're able to do that because you have the dexterity, the core stability, and the flexibility, mobility to do those things.
It shows us a lot. Just that one getting up and down unassisted shows us
Yeah,
so much as from the medical side and the
sure.
fitness side. Yeah. Okay, I'm gonna go next for you, so you get to go first on this one. So,
Okay.
as I said at the beginning, bladder and vaginal health is so important to me, and it's a passion point because I find it's where our patients are most silently struggling and don't know it or think it's just part of normal aging or it's how their body is, and so this is just kind of the hand they've been dealt, so to speak, and don't realize that they even need to ask for help. And it is usually one of the biggest aha moments. As a provider, I want the magic wand, and I don't have the magic wand, and I would give anything for the magic wand. But in this category, this is why I'm so passionate about it. There's a magic wand. So I'm going to let you go first. So, sex health is often dismissed as we age. Unfortunately, this is another. I talk about it with all my patients because it's so important. So, how do we shift the mindset from this is just part of getting older to, and I can hear you saying this, like, I deserve to feel vibrant and comfortable at every age?
No, I think this is great. Like, honestly, my husband and I started listening to, there's some great podcasts, some great, I think there's like Sexy Marriage Radio and there's like three or four my husband listens to often. And I would say if this is an uncomfortable subject, or you feel like there's shame wrapped around this, or you feel like it's taboo, or you just don't even know where to start, there are some great podcasts out there that it's just well worth your time. When you're in the car driving and getting groceries and going from A to B, start looking for some of these podcasts and listening to them, because it's, I think, one, normalizing the conversation that I want to continue to be intimate sexually with my husband until the day we die. Like, you're just going to figure things out. But knowing our bodies are changing, maybe some of the mindset is my body doesn't look like it used to, so I don't feel beautiful. I don't. So that's a mindset shift of, you know what, I want to honor and love my body. So maybe there's some things I can do. But yes, at 50, I'm not going to look like I did at 20 unless I really started, taking care of my body better as I age. And maybe I do look better at 50 than I did in my 20s. So, I mean, honestly, it can be different for anyone. But it's really normalizing it, knowing that if there's some physical symptoms that are keeping me from having sexual intimacy, I need to address those and take care of those. Knowing that it is a gift for me and my partner to enjoy together. So let's look at those symptoms of what's happening. And just two, sexual health reflects the whole body health. Honestly, Steve and I, my husband and I, do a lot of marriage counseling, and he will say sex is the bloodhound almost, that if we're not having intimacy and not having sex with our spouse, it's like, what's going on that we want to address so that we really are able to have that with comfortability, and that beautiful, I feel like, God-given gift to one another, our spouse. And vibrancy is not vanity. So we can really just be confident and comfortable. And I love when I see older couples and they're walking hand in hand, they're affectionate. It's just beautiful. So I think that is the goal of how I can stay, vibrant and beautiful, like knowing that my body does not need to be a 10 out of 10. And, when I think of I don't know, way back then, that movie called 10, but Bo Derek, that ages me. But just that we really find that our body is a gift, and it's a beautiful God-given gift. So how can we really take care of it and really be able to enjoy it for the pleasure sake of it is how it was made and designed.
Yeah, love it.
So my friend Julie, this is the last topic, and I know this is your like ammo. Here we go.
Yeah.
But you've mentioned, and actually, I tell you, I had a friend this morning said that she had a UTI. So you've mentioned that recurrent UTIs are nearly 100% preventable with vaginal estrogen. Why isn't this standard care, and how does this change a woman's quality of life? What is she doing, or what does she need to do here?
Yes, and I have multiple patient examples from my private practice who this has been the magic wand, and their lives and intimacy have changed exponentially because of it. So, genitourinary syndrome of menopause is the new term. I think it came out probably in the last 6 to 9 months. It's not a new concept, it's just a better, more appropriate named term for the literal, like, transitional hormonal menopausal changes and how that directly impacts your bladder tissue health and your vaginal tissue health. So, it used to be called decades ago, which this is horrible, but this is what it was, a medical diagnosis. Senile vagina, literally. And then it switched to vaginal atrophy, which is even worse. I mean, really, like, we're just withering away down there, but we really are. Because when our estrogen levels tank, that's what's keeping us hydrated and plump, and the tissue's healthy and happy and lubricated. And so as our estrogen levels go down, our tissue becomes more fragile, more thin, friable. So that's what, like, women who go through menopause, there's a big percentage of them that end up not having sex anymore. And it's not because the desire is gone, it's because it's so horribly painful. And that is completely preventable. The UTI, the reason the urinary tract infections go up is because the tissue becomes more friable and does start to get thin. And so then the bacteria now has an opportunity direct route up through your to your bladder through your urethra, and that's why the UTI rates go up. And this is happening in my perimenopausal women in their late 30s, early 40s. These changes are affecting the pH balance, the flora down there, and it's affecting, pain with sex. And if there's dryness, then there's going to be more friction and tearing, which is going to breed, bacteria loves an entry door, an opportunity to get up in there. And so vaginal estrogen is very safe. So this kind of like, I need people to know, like, short of like on active chemotherapy for hormone positive breast cancer, that's probably going to be the one patient population, which it would still be fine, but probably the one patient population where traditional medicine is going to look at me like, what are you doing? But it's safe. It is so safe because it's literally externally applied at the labia. And I have women who have been dealing with years and years of antibiotic therapy multiple times a year, which wrecks our gut, which Christine and I have done a gut webinar. So it wrecks your gut, thinking that it's something wrong with them, that they're not clean enough. They're having these strict routines around their, when they have sex and when they can't have sex because of the UTIs. They're UTI free. They're UTI free. And like so tearful because like their sex life is back. It's not that they don't want to have sex. It's either that hurts, they're bleeding, it's painful, or they're having recurrent UTIs. So I get excited. So yes, vaginal estrogen is safe and wonderful for most people. And up to like 75% of perimenopausal, menopausal women go through this. So the hot flashes are one thing. Those eventually will go away. The symptoms that I just talked about with bladder health, UTIs, and vaginal health is progressive. It's just going to worsen over time without treatment. So it's not that you need to do oral estrogen or testosterone or like all those things. Like literally just low dose vaginal estrogen, I call it at the front door down there, goes in like 3 times a week. Very small amount, goes a long way. I have women who are like, it was the Sahara Desert, and now like I almost need a liner because I'm so hydrated. And then I had another this cute, she's 65, and she goes, Julie, my kitty is purring again, and I need you to now see my husband to get his engine started.
Oh my word, that's awesome. That's
I
so
Isn't
good.
that adorable? And I was just like,
And it's
see, like
hilarious.
such a simple thing. So
Hmm.
I'll
So
pause there. Like, yeah, go ahead.
yes, no, I think that's great. So even for me, like a follow-up question could be for someone that's listening to this, even on the recording of, okay, so then is that I go to my doctor, I go to my, with you or someone like you, nurse practitioner, I order it via compounding pharmacy because you've given me the script for it. Like, what's the way that someone can get a hold of something like that?
Yeah, that's an awesome follow-up question. So I personally do estriol. So there's 3 types of estrogen. There's estrone, E1, estradiol, E2. That's the one most of us know about. So when you say the word estrogen, most regular people are like, oh, that's estrogen. There's one kind. It's estrogen. It's really estradiol. That's the most common one. It's the most potent one, and it's the one that can be the most damaging if other metabolic things are not in check. So that's your estradiol, and then the estriol is E3. So that's our third. So we have 3. The first 2 are more potent and powerful. The E3 is the least. It's only highest when we're pregnant. You don't get that from a commercial pharmacy. So to answer your question, Christine, estradiol vaginal cream can come from your local pharmacy. Your primary care team might be comfortable, but probably your OBGYN is going to be most comfortable. And any functional medicine provider is absolutely going to be comfortable doing that. I put my patients on estriol, which is the E3 because it's the least potent. So I get the biggest benefit, magic wand with the least impact. And I mix it with hyaluronic acid. I don't, the pharmacy does. So at the compounding pharmacy, because then it's the safest one and you get the additional hydration support with the hyaluronic acid. But absolutely, estradiol cream commercially at your local pharmacy is going to do the same absolute thing. Like same benefit, completely safe, and wonderful.
Hmm. But you've added where you do the E3 with the hyaluronic acid, so it's more of a it's a package deal that makes it just more lubricated and gentle and whatnot,
Yeah.
and doesn't put too much estrogen if you don't need that much more.
Right.
It's a
So the
saving.
I had a pelvic floor specialist recently tell me she's just in my circle of colleagues. And so she said that she recently had a patient who was given vaginal Valium. So Valium, for those of you that don't know what Valium is, it's like diazepam or Valium. It's a strong, strong sedative benzo. If you take it as a pill, you're going to be really, really, really tired because think of it as almost like a strong pain medicine.
Mhm.
It's not a narcotic, but it's potent, and you're going to have strong systemic effects. Well, her patient, for muscle floor tightening, like she just couldn't relax her pelvic floor muscles, they did vaginal Valium, completely relaxed the pelvic floor muscles with no body effects whatsoever. I can check your estrogen levels in your bloodstream with you using topical vaginal locally down there. I'm not going to appreciate any changes. Oh, minute changes. It does not make your blood estrogen levels go up. And that's where I think it's literally localized tissue support, which is what makes it so safe. It's different
Okay.
than a patch, different than a pill. Those you're going to have increased blood numbers of estrogen, but the vaginal is amazing.
Wonderful. Good stuff. Well, I feel like for us, like if there's anyone that's on that wants to ask questions, I think this is a time because we really want to respect your time
Yeah.
and also knowing that this will be recorded. This is something you can pause and re-listen to, but also know if there's a friend or two that you actually can send it to them. So it looks like Stacy, you have a question.
Yeah, so I had a question. Over the last year, now that I'm officially 47, it seems that all of my doctors are using perimenopause as an excuse for whatever's wrong with me, right? So, I had a shoulder surgery. I ended up having frozen shoulder, obviously perimenopause, only reason. Same, I had some discoloration on my face. Perimenopause was the only excuse. My eyes are getting worse, perimenopause. So, how can I be a good advocate for myself towards my doctors, when it comes to now I'm of a certain age?
This, you could not have stated that more beautifully or perfectly, because it's like a copy or like a rewind press play from that I hear from so many people. So that's great that you asked it because it's coming from the patient perspective. Do you mind if I go first, Christine?
No, not at all. Please
Okay.
answer.
So the big thing with this is that it's just kind of like, well, it's just part of aging. It's just part of perimenopause. It's just part of blank. Drives me insane. And like conventionally, they are trained to just look for the check engine light only, and it's check engine light on or off. And so it's really easy to put you in the perimenopause bucket, or yep, no, this is just your current decade of life. Have fun. Like everything looks normal. So normal isn't optimal. And so you can, and I have, you know what? For those of you that are on, I have a paragraph that I will send in your follow up email with the recording of how beautifully stated by Dr. Casey Means on how, and I don't know that I have it marked, um, but I don't see, here it is. If I have it flagged, okay, I'm going to say it real quick. This is so important. So, I am requesting the following tests be ordered for me so I can better understand my overall metabolic health. I am committed to knowing where I stand with key metabolic biomarkers and tracking them over time so that I can work to keep them in a healthy range. I know that many markers can indicate subtle dysfunction long before they reach the clinical diagnostic threshold, and I want to know earlier rather than later if these changes are occurring. I appreciate your support in helping me understand my health better, and I welcome the opportunity to work with you to optimize my results. Thank you. So not like verbatim, but that's a way of you being like respectful of like, this is my body. Things are not normal. Things are changing. They can be optimal. I can be thriving instead of just surviving. I want to be healthier. I want longevity. And I can gladly give you the list of biomarkers or labs that you need to be asking for and help guide you on the why, so that you're not just like handing them this long list and being like, Julie said, but like you feel empowered and confident to know why you're asking for those things.
Wonderful. Thank you.
Yeah. Continue to advocate like you are your own best advocate, and you've got people like Christine and I to help give you that scripting or verbiage, because it can be uncomfortable, because a lot of times they kind of like who why like they're in their white jacket and they're like, why are you questioning me, I'm the one with the medical degree. Like,
Mhm.
no, like everybody is. I've been on the patient side, which is why I finally opened my own practice, because I was like, people need to be heard and seen and believed, and this is not okay anymore.
Mhm. Melissa, do you have a question? Thank you, Julie.
Yeah.
Yes, I actually, my first question was, who do you follow on social? Because if you're following them, I want to be following them. So will you share that with us or maybe include that in the follow-up
Oh,
email?
let me, but yeah, because there's not a
Yeah, yeah, yeah.
plethora, but yes. So share my follows. Okay.
Yes, please. I'm like, if you're listening to them, then I want to listen to them.
Yep.
And Stacy, thank you for asking that question because you're not alone. It's like, oh my gosh, if one more doctor says, yeah, just welcome to that stage of your life. And I'm just like, no, this stage of my life is not how my life is supposed to be. So you actually pretty much answered most of what I had by answering Stacy's question.
Yeah. Well,
So
it's so
yeah,
crazy because as women, we spend, if we're lucky, we're going to spend 30 to 40% of our lifetime in this perimenopause phase.
yeah.
40% of our lifetime. And we're just supposed to, like, it's like they just put us out to pasture. We've done what we were here to do, and so just put us out to no. We deserve to be thriving. And
Mhm.
that's why people like Christine and I are out here trying to just give you the tools and the confidence and the clarity of, like, here's what you need to be asking for and here's why, and it's okay.
Yeah, I would say, Melissa, is there anything that you feel the most stuck or the most frustrated? I don't know if that.
Well, yeah, I mean, I've been in it I'm 12 years cancer free. And so for 12 years, I have been without estrogen. Like, and I'm trying to understand that magnitude of it right there because I have been pretty good at being my own advocate. And I'm like, I told my rheumatologist, I want this, I want that, I want that. And he did it all. He tested all my stuff, but then it's like, it's coming back normal. It's coming back normal. And I'm like,
That's
"Ugh."
normal.
So it's a little frustrating. But the cortisol, I've been learning a lot. And you just spoke, Christine, you spoke to the parasympathetic. And so I'm learning all that stuff and hearing you guys kind of reinforce that and speak to that. I feel like this information is super helpful to me because I'm like, okay, ask that. Okay, ask that. I think it's probably it's the blood work, it's the metabolic panel, it's that stuff, those specific key things. That's the greatest thing I need to ask for right now from my primary care and my rheumatologist, my oncologist. I mean, all my gists. I don't know. I need to ask them. I need to ask them all. I need this, because I know the depression, the anxiety, the sleep deprivation, all of it.
Mm-hmm.
Stacy knows me very well. She knows I got a lot of joy, but no, I mean, it's hard and it's getting harder. So
Yeah.
all of this has been super helpful. I got to start there. I got to start with getting my blood work.
So I will also include in the follow up email my
Yeah,
my go to list of biomarkers of blood labs.
perfect.
Yeah,
Perfect.
and the why,
That's awesome.
and the why. Yeah.
That's
Yeah.
the biggest thing I need because you were speaking also to Chat GPT and Steve, and me too. I do. It's not a therapist. I've been told by Stephen Furtick, the pastor, Chat GPT is not a therapist, but it is very helpful because it
Mhm.
can gain information. And so when I walked into my rheumatologist appointment, I had 3 pages of it, and he was like, "Okay, let's get started."
Yep.
Yeah.
So we got
No,
to do it.
I
Got
think
to do it.
you don't know if you don't know what the target is and what you should be looking at, and I think we are all on this for a reason that we want to thrive, not just mm, like imp along, you know what I mean? Like limp
Sure.
along in life and we just want longevity. We want to live our health span and our lifespan to just coexist together. And so then it's knowing what am I shooting at? What am I shooting for? What is my target? And I think that's why, if again, finding someone like Julie in your state, because since she's not in Nevada, But that you can get some clear cut, oh, this is why, this is the one thing I need to do. And this is what when I work with clients, I just have them focus on one thing because if they are like, okay, now I'm gonna get like 8 hours of sleep, and then I'm gonna like get my 130 grams of protein a day, and then I'm gonna like, walk 5 miles every day, and they're overwhelmed, and then they shut down and don't do anything. So I say just focus on one key like stress management technique this year or something about your overall health, just one thing. And that becomes like an easy, like, oh, I didn't even think about it. It's like I get up and drink coffee because it's a normal thing. Then tackle another. And I think that way there's no overwhelm. Because the moment I think for moms, we're already at a state where like I'm overcommitted, I'm overwhelmed, I'm fried, I'm frustrated, and then I'm just gonna do nothing. So about it, do one and get really. Does it make sense?
Christine, you're breaking up a little bit.
Oh, does that make sense?
Yeah. Okay.
Okay.
She's back.
Yeah, I think you've just charged Stacy and I to find that person, right, Stacy? You in? We're gonna
Yep,
find
definitely.
we're gonna find that person in Nevada,
Yep.
and then we're gonna call you to double check everything that they say.
I will gladly double check it for you if you'd like.
Yeah.
Can I
Awesome.
ask one more question,
Yeah, I love it.
Christine? Christine, you mentioned right strength training and exercise. I feel like there's also too much, right? Where now it's getting us, too far along. And is that really the case? Is 7 days a week excessive if it's outside of, maybe just a walk? That's that's what I think about as well, because they talk a lot about the rest portion and how important that is. And I feel like it's hard to get the rest and stay consistent.
Um, I don't know if
We'll
she
see if she
froze.
gets unfrozen.
Yeah. So
We'll see if she gets
while
unfrozen.
while she gets unfrozen, I'll speak to the cortisol side of it. So doing oh, she's
You guys
back.
hear me? Sorry. Yes, rest is important. I I would say because I have a garage gym and I'm a personal trainer, I probably work out 5 times a week, but I used to work out an hour and a half 5 days a week or 6 days a week. Now I can be fine with working out 30 to 40 minutes 5 or 6 days a week, right? So I've really cut down because I realized I was metabolically producing a lot of inflammation because I was overdoing it.
Yep.
There was a season of my life I was very competitive, and now I've really backed out on that. So for me, telling someone 4 days a week, 30 to 40 minutes max is a really healthy, to me, a healthy parameter. And there's a rest day. If I want to walk my dogs at a leisure pace, for an hour, wonderful. If I want to sit and just rest and read and do things so therapeutic, that's what I'm going to do. So it's really given my permission to rest. Um, and if I walk, usually I work out and then Steve and I might walk our dogs for like a mile and a half or two, and maybe I'll wear a weight vest twice a week, 14, 20 pound weight vest, or maybe I don't. So I think it's really resting and listening to my body. But you're right, we can overdo it. And I think there was a season that if I did it. And many people think about, I need to lose weight, so I'm going to work out more, I'm going to eat less and cut calories. And that is literally the wrong advice to do.
Yep. It's the opposite.
If
Yeah.
anything, I would rather be slow and controlled movements, being very intentional. And I need to take advantage of that recovery window and feed my body. So I really tell women as we age, I didn't say this, but we need around minimum 30 grams of protein. I think that's when the leucine or the synthesis happens for us. If we're in our 20s, we can get away with less protein to really have our muscle really, work itself and build. When we're older, we really need in a sitting, we need about 30 grams. So I aim for 30 grams of protein. I chat GPT it. If I need to add a hard-boiled egg or another egg or a little bit more Greek yogurt to make
Mhm.
sure, because I can do a protein shake and easily get 30 grams, 35 grams. But if I'm having something else, I make myself get 30 something grams of protein in that sitting. Sometimes I'm getting up to like 60 grams because I'm having a really good chicken breast. I'm having something else. So those were game changers. Rest and restore,
Yep.
I love moving my body for joy, not punishment. So it's again, this is for joy and loving my body, not for punishment to whittle it down to a size that I think is acceptable.
Yeah.
And yeah, I think that's a great question, Stacy.
Yep.
Julie, did you have more to share on the cortisone side?
Yeah,
Cortisol?
so with the cortisol, so what happens is what you're talking about, like you're doing 5, 6 days a week and you're going crazy and you're doing hour workouts. Like it is in our 40s and 50s and 60s, it is really, arguably even our late 30s, affecting our cortisol spikes, which is our fight or flight response. So it's like you're running away from a tiger, no matter, like that's how your body perceives it. So you are going to put on, sorry, hold on, let me decline this. You are going to put on more weight, so you're going to actually be weight loss resistant, and you're going to put on an extra 5 to 10 pounds around your waistline. And that's why all of a sudden people are like, I've never had this like muffin top or this belly, where did it come from? I can't get rid of it. That screams cortisol to me, because most of your cortisol receptors are concentrated in your abdomen, and that's why the weight goes there.
Yeah. It's interesting. My husband, I told you, lost like 17 pounds since January, like actually February. Like I think we left on our trip into February, and he has just been prioritizing protein and resting more. He's sleeping on average an hour more than he used to. And he says, "Oh my gosh, I woke up and I lost a pound or two." Like prioritizing protein and resting more. And again, that chronic stress tells your body everything else is secondary.
Yep.
Primary is survival. So I'm not going to rest. I mean, your body's just like, I'm not going to restore. I'm not going to heal. I'm not going to rest and digest. And so everything just is in this survival mode, and
It stores everything. Yeah.
and it stores everything as fat,
Yep.
sadly. Hmm.
Mm-hmm.
Thank you.
Yeah. Thank you
Yeah.
for the questions. I love it.
You guys are rock stars for being on and asking these good questions.
Yeah. Well, we're at the
Well,
hour
we
mark.
got to get
Hour
the
and 4
recording,
minutes.
right?
Yeah. Yeah. It's still
We got to
recording.
get the recording. I had 6 other women that said, I have to work. I can't be on. Send me the recording. I said,
Yeah.
okay.
Yeah.
Okay, awesome,
And if you
girl.
have issues in the email, just let me know, Melissa, and I'm happy to like send it to you one off as well, so you've got it. But I need to get all those good details in the follow up email for you. Okay, awesome. All right, well, thank you everyone so much for your time and engagement and attendance, and I love it. And please, please, please share this with all the women in your life who can benefit from this additional information, so we can continue to empower women, so we can be our own best advocates. And Christine and I are always a phone call away, email message away with any questions, concerns, guidance, scripting, love, all the things. So with that, thank you guys so much.
Thank you so much.
Thank you. Have a good rest of your week. Bye.
Thank you.